And if you would like your groin touched by Dr. Tom, subscribe to the YouTube channel. Welcome to the best hour of their day podcast with your hosts, Jason Fernandez.
And me, Jason Ackerman. With more than 20 years in the business,
As both coaches and affiliate owners,
our passion is to help create world-class affiliates
and coaches by building
better
boxes.
Welcome to
The best hour of your day.
All right, we're here with Dr. Tom, CrossFit Medical Society.
Affiliate owner as well.
That's correct.
Where's your affiliate?
About 30 minutes east of Cleveland, Chagrin Falls.
Oh,
yeah.
Where my wife is from, like Fairview Park.
Okay.
Yeah,
I don't
so
know the area that
okay.
well. So.
Are you not from that area?
My wife is from that area.
Oh, okay.
I grew up in Southern Ohio, so we've been back
Got
about
it.
3 years. So I don't know all the ins and outs yet.
Got it.
Yep.
Okay. It's Ohio. You'll move out eventually.
No, man. I was out for 25 years. I moved back.
It's like I know
Trust
so
me,
many people
brother.
from Ohio, but nobody lives in Ohio anymore. That's the joke.
They're
Yeah.
coming back, man.
Yeah.
Where'd you
Just
go to
all
med
the-
school?
Arizona.
And then you were out for a bit and then moved back to...
I was in the Bay Area for 25 years.
What?
Yeah.
As a doctor, what made you decide to open a CrossFit affiliate?
Well, I didn't open it. So the co-founder of the Medical Society opened Chagrin Falls CrossFit a decade ago, right? So it's a 10-year affiliate.
Cool.
When I moved back about 3 years ago, we started doing some nutrition work together that grew into the passion of the affiliate, and the rest is history. And so the dream was always to bring together the practice of medicine to where health is created, which is in the affiliate. So we were able to do those two things.
So, and talk to us about this. How did you become part of the medical society? Usually Mike G's here representing.
Yeah.
This is the first time I haven't seen him. I see
This
you.
is an upgrade, I'll be honest
Yeah.
with you. The beard, everything.
Way
is
better
good.
than
Yeah.
Mike
Listen,
G.
props to Mike G. Mike G just got married.
Not
He
even
was
a
on his
doctor.
honeymoon.
Oh, he got married.
Yeah,
that's
man.
right.
So he is
I
on
just
gotta
a
text
he's
him,
on
tell him
a
congrats, yeah.
well-deserved vacation.
Very much so.
Yeah.
Yeah.
So, yeah. Sorry, you're stuck with me
No,
this
that's
weekend.
good.
No, this has
So
been great.
family medicine.
Yep.
Yep. And then you spoke at the health summit in here last year,
Yeah,
right?
man.
Was it last year?
Yeah.
Yeah. Okay.
Yeah. last year.
I wanted to make it. We couldn't. I heard it was great.
It was awesome.
Yeah. Really
Yeah.
cool. And then
Yeah.
you gave a presentation today.
We did talk today.
And what we want to talk about is the community care. So you guys launched this endeavor, kind of like, I think it's a pretty
Super
big deal.
cool.
I think it's a huge deal.
Yeah, I think it's a huge deal. And
Deal.
you were very much up there pounding the drum of the degree with which healthcare is broken.
Yeah, I don't think that's news to any
not
of
to this
us.
group. But I was like, I like this guy. He's really unhappy with what's going on there. And we all should be, quite frankly. So tell us a little bit about the community care.
Yeah, I think, when Jen and I co-founded the CrossFit Medical Society, our primary goal, right, well, really there's two central missions. As affiliate owners and as coaches, we wanted to do things that bring value to the community and the affiliate, right? So that was always first and foremost. But one of the first missions is to help return control of a healthcare journey to the individual, right? So providing an ecosystem with providers and access to biomarkers and labs and other things that allow people to do that, right? To get information about themselves so that they can make independent decisions and not be dependent on a dysfunctional system.
Right.
The second central mission, right, is to elevate the value proposition of the affiliate to the members who are already there and help bring in individuals who don't know yet that they need CrossFit, but that it's the best thing for them, right? So a lot of the work that we do is around creating assets and tools and resources to help affiliates build out true health homes, because we do believe, as we talked about today, that healthcare should transition back to where health is created and valued, which is in the affiliate. And in CrossFit, we are blessed with having healthcare practitioners of all different stripes throughout our affiliates around the country and around the world. And so for a lot of us, we did this a couple of years ago, integrating, a practice into our affiliate. A way that we could have these discussions and support other affiliates to do this at scale was through the Medical Society.
Right.
So that's a lot of the central work. In building the ecosystem and talking a little bit about what we announced today, it is no surprise to any of us that the insurance system is dysfunctional. and doesn't serve the vast majority of us very
When you were
well.
saying that, I had a thought. So tell me what you think about this. When you said dysfunctional, I actually disagree. And I'll tell you why.
Oh, I know what
He
you're going to
disagrees
say.
with
Yeah,
most
I know what
things.
you're going to say.
I
It's
think you
very
probably
effective.
I agree with you. Like, it's not broken. It's working exactly
Yes.
the way that they want it
you're
to
right,
work.
brother.
Right. This
Yeah.
is. They're like, this is my previous life was in the military and I worked in government contracting. Like, oh, they're wasting a bunch of money. I'm like, no, the money's going exactly where they
Yes.
want it to go. It's just not going where you think it's
it's very
going.
well said.
So, I actually think we need to stop saying that it's dysfunctional. I think we need to say, like, it's just fundamentally corrupt.
Its incentives are completely
Misaligned.
misaligned with what it purports to do.
Yes.
Right? The only way it can make more money is by us getting sicker.
Correct.
Right? And that's
And you put some numbers up there. You're like, this is all the money that you pay to basically. You said this is what you pay: $28,536. way off,
$23,936
but close.
is the average.
What you pay to pay more money.
That's the privilege. That is what you pay to have the privilege to pay more.
Right.
To
I'm just
not
like-
have your
I
health care
was like,
needs
oh
covered.
God.
Yeah.
So
Yeah.
tell us what we're offering, and you put this together for affiliate owners.
Yeah.
So for some, they've not been to a summit. They
Yeah.
haven't heard you
Yeah.
talk.
Yeah. This is really exciting for us. So with the addition of CommunityCare, we feel now that we have the tools and resources that allow us to remove ourselves from the disease economy if that's what we choose to do. Okay? You have access to providers through the directory. You have access to biomarkers at the best price that I think is available, an actual comprehensive lab panel.
So people
that-
can get blood work.
Yeah, absolutely. Right. Directly themselves without even having a provider and do with that information.
So I can
what
just
they
go
wish.
in there and request proactively, I'd like to get this done.
Yeah, 100%. You can do that right now. And the piece that we announced today is CommunityCare, which is a way to pay for healthcare expenses without needing traditional insurance, which is extremely exciting. So you no longer need to be uninsured. You no longer need to be underinsured. There are no more disastrous copays. There are no more out-of-network surprise bills. You know, the largest driver of bankruptcies in the United States is healthcare debt, right? 330,000 of the 500,000 that occur, over 66% are driven by healthcare debt.
Yeah, medical costs.
Yeah, 90% of the population that's insured, of those, 40% plus carry some form of medical debt that they can't pay off. I mean, the numbers are staggering.
All right, guys, if you like this content, please subscribe to the podcast. But understand, we work with affiliates. If you are interested in building your business, understanding strategy, building a better community, and building better coaches and careers for them, hit the link somewhere around this video, and we'd love to have a call with you.
Right.
Well, it's also, and if you have insurance, I can't, we're obviously on the edges, on the fringes, meaning like if you're in the CrossFit community, you're very much proactive about your health. You're not going to the doctor because you're sick. For a lot of us, it's frustrating because like I can't be like my doctor's not going to give me proactive blood work. Or they're like, oh, that's the insurance isn't going to cover that. And I'm like,
Correct.
I don't give a shit. I want to know what my hemoglobin A1C is. I want to know what my fasting insulin
Yeah.
is. Like
Well,
they're like, you're not pre-diabetic, and I'm like, that's not the fucking point.
Right. Well, even more troubling than that, if they got those numbers, they probably wouldn't know what to do with it or how to educate you around
Right.
how to optimize that because
Right.
we don't get taught that in school, right? But with the advent of CommunityCare, to talk a little bit more about that, essentially what it is a crowd-funded platform where all of us can pay $55 a month and you're in, okay? You have a health event.
When you say all of us, affiliate owners, coaches,
So
members,
phase one is for affiliate owners and coaches first.
what do they have to have? Their level 1?
So they need to be actively coaching, which hopefully means they have a level 1,
Not
or
necessarily, but
an affiliate owner. Yes.
Okay.
So they
but
need
if
to
they
be
coach at a box,
if
they
they have
can buy in.
if they have a CrossFit ID, right, and they coach at a box.
okay, so they have an
Got it,
idea.
yeah.
That,
So that email, so this was obviously going to go out after this event, but that email went out today.
Which email?
The email that announced that.
I think that it went out in the affiliate newsletter, which I think was yesterday.
Oh, okay. Well, I
Yeah.
saw it today,
Yeah,
so
yeah,
maybe
yeah.
I just missed it
Yep,
yesterday. But
yep,
like, it's
yep.
out. So check your email inbox. There's information in
Yeah,
there.
yeah.
And then I'm sure there will be much more coming
Yeah,
out.
no, the website is quite detailed.
So
you
saying-
can go on, sign up now. Enrollment is live, and the switch.
We'll put the link
flips.
in there in
Yeah.
this video too.
Flip
So,
flips on the first.
$55, what does that get?
So $55 is your membership fee. All right, so that brings you into the community. And then what happens is if you have a health event, you submit that bill to the community, it gets crowdfunded, and that's it. Right? So on top of the $55, there will be a movement of how much you pay that month based on what the community needs. But the beauty is that that's capped at $195.
So if you're not getting enough money coming in, it's capped. And how,
So you will never pay more than $195 a month as an individual. Okay, most months you will pay less than that because the needs are lower, right? So we partnered with a company called Crowd Health to create this. They've been doing this for years. They've paid over 20,000 bills and $10 million in healthcare costs. And they've only asked for the full $195 twice. Two of those months that they've been operating. Okay, in July they asked for $60 on top of your 55. So,
so you pay your 55 and they fund the rest by asking for a second payment.
140 is the max.
Yep.
Yep. So it's capped at 195.
That's cool.
You get unlimited virtual primary care. You get unlimited mental health visits, and you get discounts.
I'll max that out.
And you get discounts on prescriptions.
And then what if something? So like Fern said, we're proactive. We're all doing this CrossFit thing. We eat meats, vegetables, etc.
Yep.
What if something more catastrophic should happen?
Yeah.
A car accident.
Yeah.
A disease that is not based on.
Yes. This is the beauty of this, right? Because with traditional insurance, when you have that, your deductible can be $5,000, $10,000,
right.
$20,000
mine with
sometimes.
2 kids
right?
is like $10,000.
With CommunityCare, it's capped at $500.
So
So, as an example, you're in the affiliate. No, you're not in the affiliate because it wouldn't happen in the affiliate. You're walking down the street, you're texting, or you're watching your latest YouTube video. You trip, break your leg.
Watching the Best Hour podcast,
It
you're
happens.
fully engaged.
It happens, right? Consuming. You get taken to the ER. You go in when they check you in to have you. Okay, what's your insurance? You say, I'm a cash pay. Bill me later. They do everything. They take care of it. You get the bill. We have a dedicated CrossFit Medical Society Community Care health advocate. Her name is Lizzie. She was here today. You submit that bill to CommunityCare. We call the hospital and negotiate a cash price. Brings
That's
it
what
down
I thought you were gonna say,
brings it
yeah,
down to half,
Right.
a third, maybe, of what you would have paid. Crowd funds it, pays it, done deal.
When you say crowd funds it, it's not like, hey, Jay broke his knee. We need to fund this.
Correct.
It's just
Because I would choose not to donate
your
to
firm be
that.
like, what was he doing? Did he deserve it?
Yeah.
No, but it's
I'm gonna withhold funds.
The 55 times thousands of people.
This is the need. This is the
comes
need
out,
of the
right?
community this month. This is the
Is it
funding
specific
request.
like Jay broke his
no,
elbow?
no, you don't say who's getting
There's
what.
HIPAA involved.
Yeah.
And then
That's cool.
What about someone like me, an affiliate owner with a wife and kids?
Yeah, it's open to families. My family's on it.
So you do 55 per person?
Each individual. Yep.
Okay.
No matter
Yeah.
the-
So
no
the
matter the
family.
age?
Yeah. So the family base, right, is 400, 405, whatever it
That's
is.
still pennies compared to what most people.
When you look at the comparisons, and I encourage everybody to go to the website because there's a lot of case scenarios, there's a lot of price comparisons for this, right?
What's the website?
It's so if you go to the CrossFit Medical Society website, there's a link there on the main webpage that'll take you to it. It's integrated into our
is that
website.
CrossFitMedicalSociety.org?
Com.
Okay.
Yeah,
Got
I
it.
believe.
Okay.
Yeah. There's a lot of scenarios that'll outline it. It's about a quarter of what traditional
Oh, I
healthcare
know
would
what
cost you.
I pay.
Even if you don't use it, that's just you paying the premiums compared to actually using community.
Oh, I
Well,
pay-
because you pay that and then you pay more whenever something happens.
Yeah, if you actually have to pay your deductible, it's going to be.
No, I pay 1,500 a month
Yes,
for health insurance, and nothing's covered
correct.
because we don't use it often enough. So when we do, it's like, cool, your deductible's not been met.
And I didn't include this, but you also get a free blood panel each year. So free primary care, telehealth visits, unlimited, free mental health care, discounts on prescriptions, and a blood panel a year that's included.
I get asked all the time, what gym software should a gym owner use? And the short answer is, I don't care. What I care about is the companies like PushPress design software that helps gym owners run better businesses. So if you're working with a software company, you're not happy, and you don't know what to do with the information that software gives you every single day, check out PushPress. They've got built-in systems like the 180-day journey that we helped them build inside of PushPress Grow that'll help you interact with your clients at a better clip in order to improve your retention. So if that's something you're interested, reach out to those guys at PushPress and help you run a better box today. Who do you guys have physicians who will help you figure out? So like, let's say he wants to get a blood panel, be like,
Yep.
hey, these are what we think you should get. Or how extensive of a blood panel can I get?
Yeah, so there is one that already exists on the CFMS website now.
Okay.
It's D2C, so you can go on there. In my opinion, it has all of the core things that all of us should get.
Okay.
Right. So a detailed NMR lipid panel that has your ApoB, LP(a), a full metabolic panel that has fasting insulin, A1C.
Which you're not going to get if you go to a normal primary care, by the way.
No.
Yeah.
Never.
Yeah.
It would never be covered, right?
Yeah.
Which is the diabolical component of this, right? Because insurance does not want to pay for what will keep you healthy because they make more money when you are sick.
Right.
Because their income, their revenue is capped as a percentage, right? So the only way that they can make more money is by the cost of healthcare going up and your premiums going up.
Right.
So diabolically, we have to get more sick for them to make more money. And they want to make more money, and that's why costs are projected to go up.
A lot.
Yes, sir.
Yeah.
And to be clear, someone that owns an affiliate, their significant other doesn't have to be credentialed.
Correct.
Or a
It'd
coach,
be family.
as long as it's a family member.
Correct. Yeah.
Well, this
that's
is because we get questions all the time from affiliate owners like, hey, I want to offer benefits for my coaching staff.
Because you
And
can
I'm
pay
like,
for it for your coach.
well,
for
this is the
$55
most
a month.
cost-effective way to offer benefits to your staff that you can
I didn't
possibly.
mention this.
Keep it down, because Katie is going to be asking us.
She's so needy.
For some of the
Well, I didn't
insurance
mention
shit.
this, but everybody that you refer, you also get $250
I did hear
referral
that.
bonus.
I did
Right.
hear
So
that.
even if we sign up our staff,
Correct.
we would if we're paying for
If
them.
you're an affiliate owner and you say, hey, you should sign up for CommunityCare, they take your referral code, they enter it in when they sign up, you get $250.
I'm suggesting this. We own a company.
Mm-hmm.
All of our staff has their level 1. Could we then offer them this from within the company?
Yeah, let's talk afterwards.
I have ideas.
Careful.
Yeah, I have ideas.
We're about to spend.
This is
We're about
really
to spend
cool.
money.
This is really.
Nate, you didn't hear any of that.
What was because I know not a lot about this, but I had similar thoughts about like why couldn't we just take a big group of healthy people that don't have tremendous amount of health care costs? If you think about most people that are CrossFitters, like you pay health insurance essentially for nothing because they don't really ever go to the doctor unless they get the flu or something like that.
Or they break their knee.
Right, or something catastrophic happens. What has been the hurdle to make something like this? Clearly, it's been a challenge because we would have just done it sooner. But
Well, I think, one, it's a big jump for a lot of us, right? And it is a bit of a paradigm
to give
shift.
up the previous.
Well, and how we think about, it's new, it's different, and that's frightening for everybody, right? And so I think each of us has to kind of sit with it and analyze the pros and cons and decide if it's the right thing for us, right? And I think it's very important to say, like, as we say in CrossFit, right, it's for anybody, but it's not for everybody, right? So it's like, if you get free health coverage and you love it through, your spouse or your significant other or whatever it is, and you're happy as a clam, then ride it, right? But for many of us in the community, there's a lot of us that are potentially uninsured, right? And you're one bad injury away from a financial nightmare, or underinsured, which is no place to be, or have plans that have ridiculously high deductibles, and this allows us to not have to deal with that anymore. Not to mention getting free telehealth primary care and mental health care. Like, it's, I think the value proposition is significant. Yeah, in the future vision, I do want to mention this because this is really about trying to bring value and tools and resources back to the affiliate owners, is that we want to open this up to the community, right? Phase 1 is for...
Well, it's also going to benefit the community as a whole, right? Like,
benefits all
55 times hundreds of thousands is more than 50 times 13,000.
The larger our cohort, the healthier we are, the more money we get.
Is there any, like, hey,
you have to distribute?
You smoke cigarettes, you can't be in?
If you smoke, you can't join.
Really?
Yep.
That's cool. I mean, you're going to have people that smoke that tell you they don't.
It can be tested. It can be tested.
I'll quit smoking cigarettes tomorrow. What else would eliminate you?
So for the standard model, there is a BMI cutoff, but we negated that for the CrossFit community.
I never passed the BMI.
Neither do I.
Free, right?
Yeah.
I remember one time I had insurance and I had to get on a call.
Oh yeah.
And they were like, granted, I was a little chubby.
Yeah.
I'm not gonna lie, but I wasn't.
He's inflamed.
I wasn't off. I was at like a 38, whatever really bad is. I was like, I'm 5'3" and I lift weights.
Yeah.
Like,
100%.
what else?
Did you replace that with like an actual body fat, like an in-body scan?
So for phase 1 with affiliate owners and coaches,
low risk on
we
your
aren't
end,
we aren't putting a requirement on it, right? when
That's what I mean. Like it's low risk in that cohort.
Yeah, when we open it up to the community, right, this is about bringing value to the affiliate. So imagine a world where everybody who comes in, they need to be a member of the affiliate.
That's cool, yeah.
They need to come for 3 months. Maybe they need to come for 3 classes a week, and maybe we get a fasting insulin plus minus a visceral
What
fat
an
score.
awesome thing to be like,
Hey,
what
come
a great
to the
reason
gym.
to join a box.
Come
Like,
to the
you
gym,
don't have
save money.
insurance, right? Come to the gym, not only save money, but be insured
Right.
and be motivated to come back.
Yes.
That's crazy.
And
That's awesome.
this is what happens when incentives are aligned, right? When creating health is not only ethically and morally the right thing to do, it actually keeps more money in our pockets,
Yeah.
right? We need to start leveraging our collective fitness.
I love it.
This is really cool. What is there anything else that people should know currently? Like,
I think learn more. Go to the website. You can enroll now. We flipped the switch for kind of our founding affiliate owners and coaching members on the 1st. And the reason why we're doing it right now is because everybody's coming into open enrollment. They're kind of making their decisions
Yeah,
about
no, I have to do that. I just got the emails
what they're
going
to do for insurance, you know, and how you're going to do it. And this is a really big decision, right? You can go immediately to schedule an appointment to talk to Lizzie or another specialist at CommunityCare who can answer any questions that you have, right? So we've got a couple of months where we can really support everybody to get all those questions answered. And if you're a community member, right, and you're interested, please go onto the website and sign up to learn more or the wait list, because this is what we'll be able to take to CrossFit to show, hey, the community really wants this, our affiliates really want this. Let's open this up for everybody.
yeah, that's
love
really
it.
cool.
Yeah.
Well, they're wrapping up, so you have a social that you have to be at to
All of
host.
us, you guys better be coming
That's
too.
correct.
Yeah.
We're going to do a team dinner and then we're going to go.
Okay.
However, I definitely want to have you back on because as this evolves,
Yeah.
I think there's going to be a lot of cool stuff in the future.
Yeah,
so
really
if you guys
excited.
have
Before
questions,
we wrap up, we
yeah.
got to check that hernia. I'll cough.
You need the wide
Well,
angle
here's the
lens.
fun part. We both have a hernia, so you
got
can
one
check
hand-
both
you got
at
one
the same
hand,
time. Yeah.
Sweet Jesus.
Yeah. No, but if you guys have questions, please check it out. If you're an affiliate owner, check your inbox. It's definitely in there. Check your spam. Check it out. Questions, go to the website.
I think it was on the same email that we were on.
Oh, yeah, we were in that email, oddly enough.
Pretty cool.
But, anything else you'd like to share with listeners?
No, I think this is a very exciting time for us. I think what we can do now as a community, you know, as we talked about earlier, we've been the leader in fitness for the last 24 years. We can now show the country and the world what can happen in the healthcare space when incentives are aligned.
It's really cool. And this, I tell you what I think is really cool. This whole CrossFit Health, now Medical Society, this thing has been like it's like a slow-moving train coming down the track, and I feel like this is the first time we're like, oh, we now have a thing. Like there's now a tangible thing that this is real. So.
Well, you've also, by the way, eliminated all affiliate owners that say CrossFit isn't doing anything for
That
us.
too, you know,
Like,
and
that's massive. Like,
yeah.
oh, they're not doing anything. You could have health insurance for $55.
yeah.
Like,
So
they never need to do anything again, so long as this is still running, you know. And
don't blow it.
Thanks for the vote of confidence,
yeah.
guys.
But no, I mean that's massive, right? Like, what a great time to do it. Affiliate dues went up this year, so there's a little bit of, some chirping, and it's like, one, we got these awesome summits happening. Now we're providing insurance. It's just, I think, one of many things that's coming down the pipeline, which is really cool.
I do want to clarify, and everybody should know, it's not insurance.
It's not
Sorry, I
insurance.
misspoke.
No,
right,
and
it's
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 semantic.
crowdfunding.
Yeah, it's semantic, but it's important because it is completely different and it's
It's
new.
not traditional. You're self-insured at this point. Like that's kind of what you're doing.
Yeah.
Like I don't
Yeah.
pay my extended warranty on my car.
Yeah.
I kind of have a different mechanism to make sure that I fix the shit. That
Correct.
breaks, right.
And
So,
I think if all of us really educate ourselves over the coming months, about what this is, what it can mean, and assess its impact for us as an individual, you can make an informed choice. And I think for a lot of us, it's going to make a lot of sense.
Very cool.
well, kudos to you. I know this, and I
Dr.
know
Tom.
Mike G's been, and you guys have been
Yep.
You're way
putting in
better
a
than-
ton
way
of work
better than
into
Mike G,
this. So yeah, that's why we're having you
Poor
back.
Mike.
So I'm excited for you. Personally, I'm excited for you. I think it's really cool for this to get to launch. I'm excited for the affiliates, for the CrossFit community as a whole, and we'll definitely be having you back on to talk
I
about how
appreciate
this
it. Thanks for
progresses.
And I'll
having me on
keep
to talk about it.
Update on that. I'll send you some pics of the
I
hernia.
appreciate that.
He's going to send you guys pictures of the hernia, too. Thanks for checking out this episode of the Best Hour of Their Day podcast. We appreciate you listening and choosing to have us help you in your passion for coaching and affiliate ownership. You can find more episodes just like this on all podcast platforms. If If you're interested in learning more, you can reach out to us on any social media platforms, or you can visit www.besthouroftheirday.com to book a call. If you found this episode helpful for you, please share it so that we can help other coaches and affiliate owners to help build a bigger and stronger CrossFit community. Thanks for listening.